Skin diseases are very common global illnesses that affect more than 30% of the population worldwide. Chronic skin diseases like psoriasis, atopic dermatitis, and vitiligo, despite no associated mortality, the quality of life of patients is reduced due to the symptoms associated with the disease and the treatments. So, immunotherapy appears as a new potential treatment that can reduce the need for high doses of medicines and radiation, avoiding the side effects. State-of-the-art literature points out graphene-based materials' potential to be used in immunotherapy for skin diseases treatment, since they can reduce immune cell activation and decrease reactive oxygen species, attenuating the inflammatory reaction. They demonstrate to be biocompatible, easily degradable, and can provide a multiversity of possibilities for surface functionalization when comparing with other nanomaterials like silica and gold nanoparticles. The main objective of this work was to study the immunomodulatory effect of graphene-based materials, namely nanographene oxide (GON) and reduced nanographene oxide (RGON), combined with ultraviolet phototherapy over immune cells. Nanographene oxide was produced through the modified Hummers method, followed by ultrasonication, and after that it was photoreduced to achieve RGON. Then, the work was based on the physical and chemical characterization of both nanomaterials using some microscopy and spectroscopy techniques. They presented average sizes around 200 nanometers, surface charges near to -40 millivolts, and polydispersity indexes between 0.4 and 0.5. Those values are within the range of nanometric characteristics required to achieve good water stability, biocompatibility, and penetration through biological tissues. Both nanomaterials dispersions were stable for up to 4 months, which is a good indicator regarding the future preservation for administration. Chemical characterization allowed to confirm GON's successful oxidation and their UV partial reduction with the elimination of some oxygen-containing functional groups. Also, RGON presented a twofold increase in comparison to GON in UV absorbance at the wavelength used for phototherapy in the present study. Then, the work focused on the understanding of their immunomodulatory therapeutic effect on macrophages and dendritic cells. Viability assays showed no significant toxicity for both nanomaterials at a concentration of 100 micrograms per ml, being this concentration chosen for the following experiments. The morphology analysis showed loss and degradation of some organelles in macrophages incubated with both nanomaterials. Next, macrophage polarization was assessed by expression of specific phenotypic markers and cytokines. Both nanomaterials, with and without irradiation, induced a more pro-inflammatory phenotype, upregulating IL-6 and IL-1 beta, and downregulating IL-10. Finally, reactive oxygen species production was increased by GON and reduced in the presence of RGON, which indicates a possible scavenging capacity of this nanomaterial. Regarding dendritic cell activation, a mixed lymphocyte reaction was performed, showing that both nanomaterials, when in pro-inflammatory conditions, increased dendritic cells' capacity to promote T cell activation. Also, it was revealed the significant increase in the interferon gamma IL-4 ratio with RGON, indicating a tendency to potentiate the inflammatory reaction. In summary, the results obtained support the pro-inflammatory role of both nanomaterials alone or as adjuvants. In the future, it would be important to repeat some of the assays with a larger number of donors and to perform a detailed study of both nanomaterials concentration and different conditions of irradiation to achieve the most adequate therapeutic doses that are non-toxic and immunotherapeutic. Thank you for your attention.